in the substance use disorder healthcare work group, which used to be part of the Governor's Commission, but we're continuing to meet. And it was brought to our attention by Dr. Peter Mason that many of the patients he was seeing as the medical director of a facility who were coming with substance use disorders also had co-occurring issues with any number of things. And most prominent among those seemed to be sleep. And Carol at that point said, well, there are some powerful therapies within the great toolbox of cognitive behavioral therapy to address sleep disorders. So Carol and Peter have been on the lecture circuit and have been addressing various provider groups. And today we're extremely fortunate to have Carol with us to talk about sleep disorders. And we can move to the next slide. And I think we are ready to roll. Carol, have anything else you want me to cover on your bio?
No, that's great. Thank you very much.
So yes, we want people to understand the value of cognitive behavioral therapy in treating persons with SUD, and understanding that there are specific techniques which address sleep disorders in persons with SUD. And this is going to be experiential learning, which is great, but Carol is actually going to lead us through this so that we can actually participate and experience this. And I think next slide, we move into the presentation. And Carol, I'll turn the microphone over to you and go on mute.
Thanks, Dan. As Dan said, Dr. Peter Mason and I recently presented sort of this presentation to a group of primary care providers because our concern has been the issue of polypharmacy, that primary care providers are prescribing many, many meds, which tend to have sometimes dangerous interactions because of the combination of meds. And my concern as a therapist is that so much of this could be avoided by cognitive and behavioral techniques. I just want to say this is not necessarily a presentation on what cognitive and behavioral therapy is, but we know that CBT addresses negative patterns of thought about the self and the world that we live in, and we challenge those in order to change unwanted or unhelpful behaviors and thought patterns. So when we look at the frequent characteristics of those with substance use disorder, we know that most of them have dual diagnoses. They've lived chaotic lifestyles. Most have experienced trauma of one sort or another, and they've learned that substances can relieve emotional and physical pain. Go ahead. Culturally, this, I think, is one of the biggest issues that we're dealing with. Culturally, we believe that trauma is widespread and universal. We've done a great job of providing trauma-informed care, but the mistake that has occurred with that is now this apparent belief that everyone has suffered trauma of some sort. And I think by doing that, we minimize the actual occurrence of trauma and the effect that it has on people. Everyone who has been disappointed, everyone who has had negative experience in life has not been subjected to a trauma episode. And I'd refer you to the DSM to look at the definition of trauma. And typically it talks about an experience, either self or witnessing an experience with death or near death or the fear of death. That's a little bit different than some of the cultural beliefs. And we talk very freely when you read newspapers or in television shows and in movies about people being traumatized. I think we do a disservice when we do that. Also culturally, and we see this all the time, if you're uncomfortable emotionally, physically, mentally, then you should take something. My first awareness of this was years ago when I was watching TV and a commercial, pharmaceutical commercial came on. Now you have to remember, we are the only country basically in the world that has pharmaceutical commercials. And the presentation was, do you feel uncomfortable in large groups? Are you more comfortable speaking with friends than in a large group setting? Do you tend to sit by yourself in large groups and watch rather than participate? And they went on to describe me, because I'm very introverted, believe it or not. And I thought, well, something's wrong with this. Do I need medications? And after thinking about it for about 20 seconds, I said, no, I'm really happy with who I am. I'm not an outward social person. But there's the pitch that we give people. If you are uncomfortable, there's a med for that, you know. That's a cultural belief. In addictive thinking, especially, this is true of everyone, I think, but in addictions specifically, negative emotions are perceived as being out of our control. This happened to me, and so I am sad. I am angry. So if I had one suggestion, immediate suggestion to people who, I was going to say treat individuals, but it's the general population. When people are talking, clients or friends or family members are talking about a difficult situation that they just experienced, please don't say, and how did that make you feel? We do it because we're trying to be helpful. We're trying to get to what the emotional response was. But the message that you're also giving is that you are not in charge, that person is not in charge of their emotions, that this outward event caused them to feel something. And we'll talk a little bit later about the truth of that. And also, in addictive thinking, the only response to those kind of things is chemical. Take something for it. Okay. There are issues with prescribed medications. Too often, medications are readily described before therapy is even addressed, especially for anxiety, ADHD, and sleep. I've said this frequently. Anxiety is the most easily treated disorder in the DSM, cognitively, therapeutically, without the use of meds. But most people, maybe because of the stigma still about going to therapy, most people will go to their PCP and ask for a medication. And doctors want to welcome their patients, they want to help their patients, and so they prescribe things that are not necessarily helpful in the long run. Why are those problematic for those with addictions, those medications? Resale value. In working with the drug court program, I could tell you in a particular location, in a particular city, or even in an area of that city, I can give you the names of the prescribers who are known to freely prescribe. And when people have addictions or criminal thinking, those are the doctors that they go to because they can get an overabundance of meds to use themselves, or they can get them for their resale value. Those medications also have numbing effects. So they're not taking their illicit substances perhaps anymore, but now they're taking legal substances for the same reasons. It relieves uncomfortable feelings. I recently spoke to my niece, who's a psychologist, and her specialty is anxiety. And she said to me, if I could talk to parents of young children, what I would say to them is, please tell children that anxiety, discomfort, stress are all normal human reactions. We want to somehow eliminate those from our lifestyle, and it's just not possible. And there's also a belief in a lack of control of our thoughts, our emotions, and our behaviors. We don't do that. When people would say to me, this person makes me so angry. No, they don't have that control over your emotions. What is your thought that you have when that person does that thing, that behavior, says that thing? Get to the root of what is the thought, because your thoughts then produce your emotions and then produce those behaviors. No one else. You do that. Okay, go ahead. As a general rule, findings suggest that CBT and medications are equally effective for many disorders, including anxiety, OCD, and depression. The effects of CBT may last longer overall. CBT instills a sense of control and resiliency, and that's critically important, particularly when we're dealing with people with a substance use disorder who have focus on wanting a sense of control or having no control. And that's what the drug does for them. So control is a recurring theme throughout this. Resiliency is also important. General Mattis, I love this quote. General Mattis has been quoted as saying to veterans, "You've been told that you're broken, that you're damaged goods, but there is also post-traumatic growth. You can come back from more stronger and more sure of who you are." And I think that's an incredible piece that we can't forget. We tend to focus on the trauma and wanting to eliminate the trauma, but we don't focus on the resiliency, the strength of having it. And there are no side effects to CBT. Okay. Medications can work faster, but research has shown that patients who receive CBT are less likely to continue to experience symptoms. And if they do continue, they're more likely to have the skills to address them. You're going to have anxiety again in your life, but now you'll have the cognitive and behavioral skills to address them rather than relying on meds. Medications are not a cure. Medications are not the sole answer. And you have potential side effects and interactions from medications, which is why Peter Mason and I started looking at this, because we were concerned about that. Okay. Anxiety. Anxiety is characterized by excessive fear, worry, and apprehension. Part of life. Approximately 18 to 30% of the general population have a diagnosis of an anxiety disorder, which is incredible to me. Anxiety is highly treatable. Pharmacotherapy does not cure anxiety. It only helps to manage the symptoms. It numbs the effects, but it doesn't make it go away. And after a while, some of those meds stop working or stop working as effectively. And so what happens? They ask for an increase of meds or an alternative med, but it never addresses the issue. Okay. It's a normal human reaction from time to time. How do you know when anxiety is not normal? The reactions are out of proportion to the actual situation, and symptoms interfere with daily life. So you had a job interview and you're waiting to know whether you're going to be hired, and you're incredibly anxious about it. Okay. Is it stopping you from doing anything in life? Are you not sleeping? Are you not eating? Are you unable to go to work? That's an anxiety disorder. If you're worried about it, I hate to tell you this, but that's kind of normal. It's the old fight or flight, right? If something seems distressful, dangerous to us in some way, we have to either figure out, are we going to run from it? Are we going to ignore it? Or are we going to do something about it? And both of those are legitimate alternatives. Okay. CBT, cognitive and behavioral therapy, provides normalization of human anxiety, resulting in quick results and has long-lasting benefits. Thoughts lead to emotions, which lead to behaviors. You can address this at any one of those stages. CBT includes relaxation techniques, such as progressive relaxation, such as thinking about pleasant vacations, thinking about pleasant events, changing your environment. There's lots of different things that you can do. Okay. Okay. What about the effectiveness of CBT with anxiety? The CDC recommends behavior therapy as the first line of treatment before medication tried for children under 6 years of age. When I used to, in my private practice, moms and dads would bring in kids who had recently been diagnosed as ADHD, or was looking for a diagnosis of ADHD. And there were times when I would recommend a referral to a PCP for medications because their thinking was so disorganized, they couldn't learn new techniques. But that was seen as a temporary measure so that their thinking could be more organized in order to learn techniques. I'm not a big fan of prescribing ADHD meds for adults because they have the skills. They can have the skills to address ADHD, new ways of thinking and behaving. Multiple studies with over 13,000 participants found CBT was the most effective treatment for social anxiety. Harken back to that commercial, take a med for it. For children of all ages and young adults, research suggests that therapy may be more effective over the long term than medications given for symptoms of ADHD. How do I know this work? I'll tell you personally. I had a group in my much younger days. I had a group of young adolescent boys having a sleepover at my house. And when it was time for me to say, okay, guys, time to settle down and go to bed. And I could hear some rumbling. And then the next thing I heard was my son saying, okay, so you're going to take a deep breath, tighten all your muscles. And he was going through a progressive muscle relaxation. And within 15 minutes, they were all asleep. So if it works with adolescent boys, it'll work with anybody. Okay. Next. CBT and depression. A study of 287,282 participants found 7 lifestyle factors that influence depression and found that people who maintained at least 5 of these reduced their risk of depression by 57%. Again, changes in behavior. There's one mistake I made here. It's exercising regularly. It should be sleeping regularly, eating a good diet, limiting alcohol intake, not smoking, limiting sedentary behavior, and having social connections. All of those are important. Next. This is incredible to me. Insomnia in primary care patients is as high as 69% compared to 33% in the general population. Again, people are seeking help from primary care providers. And I can tell you, having spoken and worked with primary care providers, they're at a loss. They don't know what to do. And so some of you can be prepared. One of my solutions when I met with them was get a good referral to a clinician who has CBT skills. Studies show that CBTI, that's cognitive and behavioral therapy for insomnia, has superior effectiveness to benzodiazepine and non-benzodiazepine drugs in the long term, because those are just a supplement. Advantages of meds is they're available and there's some rapid short-term improvements. You're going to feel different, but you've not made any changes. The disadvantages are potential side effects, dependence, tolerance. It's not curative, leading to long-term treatment over many years. So think about that in terms of our substance use patients. They are really not addressing the issues. They're just taking another substance. That's different from harm reduction, I think. Although I'm certainly willing and okay with them taking this in early recovery because they need that break, but they also have to have that CBT as soon as possible. Okay, next. CBT techniques involve stimulus control, sleep restrictions, and relaxation training. It's effective for both short-term insomnia and chronic insomnia. It's typically 6 to 8 sessions when it's typically used, but it can be as short as 2 sessions if given by a PCP. If a PCP gives you these instructions, they are the authority and people listen to them much better than they listen to me or any therapist. So what does this include? It includes cognitive restructuring, changing the way you're thinking, stimulus control, and you've heard this before, the bed is only used for sleep and sex. You don't eat, you don't sleep, you don't read, you don't use electronics. You're preparing your mind to stay awake and your body. Sleep restriction and compression and relaxation training. Okay, next. So these are sleep hygiene. This is basic sleep hygiene techniques. Don't go to bed unless you're sleepy. Now that's going to be hard in the beginning, but you're going to start getting regular sleep hours. It'll get easier. If you're not asleep after 20 minutes, get out of bed. Don't go watch TV. Don't pick up your electronics. Go sit quietly someplace. Listen to music, relaxing music. Begin rituals that help you relax each night. So what helps you to relax? Get into a pattern 15 or 20 minutes before you want to go to sleep. What are you going to do? Get up at the same time every morning. Get a full night's sleep on a regular basis. Now, obviously, that's going to come gradually. Avoid taking a nap. If you have to, keep it to less than an hour and avoid naps after 3 p.m. Keep a regular schedule for yourself as much as possible. And don't read, write, eat, watch TV, talk on the phone, use electronics in bed. Don't try not to do it 20 to 30 minutes before you go to bed. You don't want to do anything that's stimulating your brain. So a lot of us didn't get sleep after the game the other night. But you have to make choices. Also, avoid caffeine after lunchtime. No alcohol within 6 hours of your bedtime. No nicotine products before bedtime. Don't go to bed hungry because you're going to be very much aware of those hunger pains. But at the same time, don't eat a big meal near bedtime. Avoid any tough exercise within 6 hours of bedtime. Exercise on a regular basis, but earlier in the day. And avoid sleeping pills or use them cautiously because, again, that's an artificial means. Don't drink alcohol while taking any sedating meds, obviously. Try to get rid of or deal with things that make you worry. If you're unable to do this, find a time of the day to get worries out of your system. Now, I recognize that sounds easier said than done, right? So earlier in the evening, you get a piece of paper, you get a notebook. What are the things you're worried about? What are the things you have to do the next day? Build up a list with as many details or little details as makes you comfortable. And then put it away. You've done it. And if you start to go to bed and you think, oh, I got to think of one more thing, okay, you can go and put that. But if you start to think, oh my God, and how am I going to do this? And what are the, no, you've done it. You've put it aside. You're going to look at it in the morning. You are absolutely not going to get anything accomplished that night. You are now ready for bed. So put it away. Tomorrow is another day. You can face that monster when you wake up in the morning. Next. Make your bedroom as comfortable as possible. They don't think about that. What helps you sleep better? Do you need complete darkness? Do you need sunlight? Do you have a nightlight somewhere in your house that you need or in your room? How warm or cold do you need it to be? Do you need a firm mattress? Do you need a softer mattress? What do you need for pillows? Do you need total quiet or background noise? Try to make this happen as much as you can. So I have a friend who his partner can only fall asleep. This is the habit she's developed now. She could sleep, but she has trained herself to believe that she can only sleep with the TV on. The problem is, my friend can only sleep in utter darkness with absolute quiet. So he's seeing the light from the TV and he's hearing the sound. And he complains, I can't sleep. All right. So what was my suggestion? Get a mask. They give them away on some airlines. You can pick them up. Cuts out all the light. And earplugs if you have to. Something to drown out the noise. And he did it, and it worked. But he was too focused on, this is not good. I can't sleep. I never get sleep. It's those kind of statements. Remember, cognitive and behavioral therapy is thoughts, emotions, behaviors. His thought was, I will never sleep because she keeps the TV on. His emotion was frustration and anger. And his behavior was, he would sometimes get even more aggravated with her because she wasn't letting him sleep. but he didn't take any action himself. So this is about cognitive and behavioral therapy is always about what can you do? Okay, next. Okay, so before we go into the exercise, I'm going to ask you to do something for me. Make a fist with one of your hands and squeeze as tight as you can. What are you noticing about your breath? Are you holding it? Are you breathing more shallowly? Yeah. Yeah, you can let it go. When we tense, we go into shallow breathing or holding our breath. That makes us tense. So progressive muscle relaxation has a big component of breathing in it. I don't usually do this in presentations, but my goal for this presentation is to put you to sleep. I usually fight against that, but it's okay this time. If you don't go to sleep, that's okay too. I'm going to ask that you close your eyes if you feel comfortable with that, because otherwise you're going to be too focused on what everyone's doing. So close your eyes, shut off the lights if you can. If you're all right with the lights on, that's okay. Make it as comfortable for yourself as you can. And all you have to do is listen to my voice and follow my directions. Okay? So close your eyes. Find a comfortable position with as many of your major muscle groups supported as possible. Just try to get comfortable in that chair. Take a deep breath. Really fill your lungs with air. And then slowly exhale. One more time. Really fill your lungs with air. Hold it to your own count of 3. And then exhale slowly. One more time. Really deep breath. Hold it to your count of 3. And this time, as you exhale, think about letting the tension leave your body. Picture it. Picture the tension leaving with your breath. Inhale one more time. Nice deep breath. Count to 3 and exhale. Keep breathing deeply. I want you to focus your attention on your feet. Pretend you're making a fist with each foot by curling the toes of each foot. Hold the muscles tight. Focus on the muscles of your feet. Feel which muscles are tense. Feel that tightness. And then slowly let the muscles relax. Just let the muscles in your feet relax. Just let them go. Continue to breathe. Tense the calves in your legs by pressing your heels down. Push them down as far as you can and hold them tight so that you're focusing on the tension that you're creating in the muscles in the back of your legs. And feel that tightness. Feel the tension. And now slowly let them relax. Just let the tension go. Let the muscles relax. You can feel the tension leaving. Now tighten the muscles in your thighs. Hold them tight. Feel the tension, the muscles tightening as though you're pulling the muscles up towards your body. Focus on the tension. Now slowly let the muscles relax. Just slowly let them relax. Really focus on the looseness. Focus on the relaxation now. Just let them go. Just slowly let them go. Slowly relax. You're going to tighten the muscles in your hips by pulling your buttocks together. Hold them tight. Focus hard on your hips. And feel the tension. Now slowly, let them relax. Let them gradually relax. Feel the tension leaving. And as the muscles in your hips relax, you'll find the muscles in your legs becoming more relaxed. Just let them all go. Allow your legs and your hips to become very relaxed. Let them ease. To tighten the muscles in your abdomen, pull your stomach in as though you wanted to touch your back with it. Hold those muscles tight and stay very focused on the tension. Feel the tension in your abdomen. Now slowly, let the muscles in your abdomen relax. Let them go. And you'll find that as the muscles in your abdomen relax, let the muscles in the very lower part of your back will also relax. Just let them go. Let them become very relaxed. Very relaxed. Now the whole lower part of your body is feeling more relaxed and more comfortable. Tighten the muscles in your back. Flatten the arch in your back somewhat. And at the same time, you're going to pull your shoulders forward so that you're stretching the muscles in your back, creating tension. Hold those muscles, hold those shoulders forward. Hold those muscles tight. Feel the tension. Stay very focused. And now slowly, gradually, let the muscles relax. Just let them relax. If you've been feeling knots of tension in your back, they'll begin to soften now. Just let them go. Let them relax. Just let them all slowly relax. To tighten the muscles in your chest, press your elbows into your waist hard so that the muscles in your chest are tense. Stay very focused on that tension. You can feel it across the top of your body, in your arms. Feel the tightness. And now slowly, let the muscles in your chest relax. Just let them go. Let your arms and your elbows slowly relax. Tighten the muscles in your shoulders again. Pull your shoulders back as though you wanted to touch them behind your back. Pull them way back and hold them tight. Feel the tension. Feel the tightness. Now gradually let them return to a comfortable position. Slowly let them become very relaxed. You may want to wiggle them around a little to be sure they're comfortable. Just allow the relaxation to replace the tension in your shoulders. Let them relax. Slowly, gradually. To create tension in your arms and your hands now, you're going to make a fist with each hand. Hold the muscles very tight and really focus on the tension that you're creating. Feel the tension. Feel where the muscles are tight. And now slowly, let those muscles relax. And you'll feel the relaxation flow from your shoulders, through your arms, to your hands, to your fingers. Let the muscles relax. Just let them go. You might even feel a tingling in your fingers. That'll pass. Just let the muscles become very relaxed. Now we're going to tighten the muscles in your neck. Very gently. Pull your chin down towards your chest. so that you're stretching the muscles in your neck. And really focus on the tension that you're creating. Hold the muscles tight. Feel the tension. Now slowly let them relax. Let the muscles in your neck relax. Just let them go. Let your chin return to a comfortable position. And now very gently and slowly, turn your head to one side as far as it will go. So you can feel the muscles in your neck being stretched. And then slowly, gently, turn it to the other side as far as it will go. Feel the muscles in your neck. And now stay focused and return your head to the center, but be sure that it's in a comfortable position. To tighten the muscles in your forehead with your eyes closed, raise your eyebrows as high as they'll go and hold them way up. Way up. Focus on the tension that you're creating in your forehead, at the top of your scalp. Hold those muscles tight, stretch them. Feel the tension. Now slowly, let the muscles relax. Just let the muscles in your forehead relax. Let them go. When they begin to relax, you may find that your eyebrows feel a little strained, a little uncomfortable. That's okay. That's them relaxing. Just let the muscles go. Let them relax. Now pull your eyebrows together over your nose as though you were frowning deeply. Feel that tension in your forehead, the top of your nose, maybe even in your scalp. Feel the tightness. And now slowly, let the muscles relax. Let your forehead smooth out. And notice that the muscles in your scalp are relaxed now. Just let them relax. Let them go. You're going to tighten the muscles in your jaw by gently pressing your teeth together, just enough to create tension in your jaw. Feel the tension. Feel that tightness. And now slowly, let those muscles relax. Let your jaw relax. To tighten the muscles in the lower part of your face, press your lips together really hard so that you can feel the tension in the lower part of your face. Feel that tension. Feel the tightness. And slowly, let those muscles relax. Let the muscles around your mouth relax. Very gently open your mouth wide so that you're stretching the muscles you just tensed as wide as you can. And really let those muscles relax again. Let them relax. Allow your lips and your teeth to stay slightly parted so the lower part of your face will stay relaxed and comfortable. Focus on the lower part of your face that you just tensed before and let all of those muscles relax. To tighten the muscles around your eyes, squeeze your eyes shut hard. Focus on the tension. And then slowly let those muscles relax. Gradually let them relax. And as you let the muscles around your eyes relax, smaller muscles in your face will begin to relax. Just let them go. Let them become very relaxed and comfortable. I want you now to take another deep breath. Hold it to your own count of 3 and exhale. Take another deep breath. Hold it to your own count of 3 and exhale. One more time. Deep breath. Count of 3 and exhale. Continue to breathe deeply. And I'm going to slowly count to 5 while you continue to breathe deeply. And when I reach 5, you can open your eyes. 1, 2, 3, 4, 5. How was it? Good. Good. Susan, I even saw you stretching more. That was great. You saw you knew where your tension was and you did it. That's perfect. Perfect. So you feel relaxed? Yeah. You want to go back to work? No. Good. You don't have to do this whole thing. I recommend doing it at night through the whole thing. And if you fall asleep during part of it, you are not allowed to beat yourself up for falling asleep. That's kind of the purpose. Do it as long as you can. And if you do it and you're still not asleep and you want to do it again, okay. There's no rules to this. Be mindful also of where you feel your tension. When you are stressed, what's the muscle group that tenses? I can tell you, I'm an old Monty Python fan, and they have a dead parrot syndrome. My shoulders go up here. And as soon as I become aware of that, I have to purposely push them down, take a couple of deep breaths. So know where your tension, where do you hold your tension? And again, as I said, you don't have to do this whole thing. If you know where your muscles of tension are and you are beginning to get a little road rage, do some of those. I don't recommend you closing your eyes, but anything else is fair game. If you feel it in your jaw and you want to stretch, so they can think you're crazy, but you're not stressed. Any questions? You look at the chat here. Good. Okay. We ended a little early. No questions at all?
Any reactions from folks, particularly the people who are in clinical settings, about your own experiences with persons you see?
Susan?
Great. Yes, I have a lot of folks with anxiety and they are trying to manage it without medications.
Yes.
So I happened upon a yoga nidra script and just reading it through, it's all there. I just need to read it to them. And, I tell them they can lie on a yoga mat that I have in my office or they can just sit in the chair. And it relaxes me reading through it with them. So it's pretty beneficial when you're having a stressful day for yourself too. But the clients really love it. And I recommend that they take the script, go home, use their phone, record it, and then just do it, when they're feeling stress, anxiety. And it really, a lot of them have never done things like this, to relax. They've used medications. And a lot of times they say, oh my gosh, I'm lightheaded. I feel so much lighter. So they actually physically notice it.
Yeah.
Yeah.
Yeah. It's amazing, isn't it? It's such a simple thing to do, but people don't have any idea of how to do it.
Yeah, and I agree. I think you're right. We get culturally trained to believe we have to take something, and something as simple as breathing or eating good food or going for a 10-minute walk, that's the last thing on the list. I'm going to try everything first, then we'll see if those other things might work. And I mean, myself, I'm amazed too at how well it works.
Yeah.
Yeah,
It's amazing what taking care of yourself can do for you.
yeah, it's great. It's wonderful. And it's cumulative, so
Yeah,
wonderful.
that's right. That's right.
Thank you so much for that.
My pleasure.
Appreciate
And
it.
Pam has her hand up.
Prior to working at Granite United Way in the recovery friendly workplace, I worked with children and I would utilize stuff like this with the children. They had a lot of frustration, a lot of trauma, a lot of anger, and it took a while, but I would be able to get them to learn how to do it themselves, even as young as I had a 5-year-old who could do it herself.
Yeah.
And it was a huge help. We saw a remarkable change in her behavior, a number of their behaviors. Honestly, the teenagers were a little tougher, but the littles loved it and they were really open to it. And I think it was that added bit of attention they would get. And I would share it like with foster parents and parents for them to utilize it. I put a comment in. I have a long history of insomnia, and I do something similar to what you did every night. I have an app, and it's a guided app, and I do it every night to go to bed because I have a hard time sleeping. So
To me, particularly for kids, kids don't necessarily feel like they have a lot of control in their lives. A lot of us have those concerns that we don't have control over our lives. And this is the message. Even though I didn't use the word control at all, you had control over what you did. And that's the inherent message in this that I think anybody, no matter what the age is, can benefit from. You want to feel better. These are steps that you can take to make yourself feel better. You have control over it. It's an incredibly important message. There's another exercise that it's not a relaxation technique, but it is a CBT technique. And it's for people who have had trauma. And I'm sorry, this is going to sound very simplistic, I know, but it works. Sometimes the simple answer is the best. So I've worked with clients who have significant trauma and they don't sleep. And part of the concern is they're afraid to go to sleep because of the nightmares they have. And so here's the assignment I give them. I want you to think about, since you're thinking about those nightmares anyways, before you go to bed, I want you to think about the nightmare that you've been having. And I want you to think about if you should have that nightmare or something similar to it tonight, what can you do to change the nightmare? What can you do to respond differently? And no matter what your answer is, it's probably okay because it's a dream. You're not doing this in real life. So if you want to punch your assailant in the nose, that's okay. You're not going to be arrested for it. The message is every day for the next 2 weeks, you have to prepare that before you go to bed. And guess what? They either don't have the dream anymore, or they have the dream, they change their reactions to the dream, and they stop having the dream. What's the difference? They had control. Instances of trauma, we don't have any control. We want to instill that sense of control for them. So this is a way of reminding them, you have control. Change your dream. We can change our dreams. It comes from our head. It's not someone else's head. These are our thoughts. Change your thoughts, change your emotions, change your behaviors, even in your dreams. And it works. They kind of are sheepishly have to admit it because you want me to change my dream? And then they did it. And I even thought, it could be that they're doing this just to get me off their back and leave them alone. But in a drug court setting, for example, where I've had some success with this, I've had a lot of success with it. It's actually to their disadvantage because as long as they're having traumatic dreams, in their criminal mind kind of manipulation survival technique, they can play that. But I have this trauma, I have these dreams. So they're taking that excuse away from themselves. But they're happy they're not having those traumatic dreams anymore. It's amazing. Any other reactions, comments?
Thank you. This has been great. I'll share briefly that as people where I spent 40 years in the fire service, and every shift begins with you checking your equipment, making sure that your protective gear is on the apparatus. And even when I was in administration, I always had my protective gear with me, and I've had this recurrent. I wouldn't call it a nightmare, but it's a stressful dream where it's like this time of the afternoon, I'm doing what I'm doing, but I'm in a fire station. I realize that my protective gear is not there, and if we go on a call, I won't have it. So it's just one of those things that is somewhere that decades-long habit, and the fact that I don't do that routine anymore is surfacing in an anxiety dream. So you've given me some tools to think that,
Yeah.
before I go to bed, we're going to kind of check the equipment and put it on there and envision that. But it's
Right.
just, I am surprised at the ability of the mind to reach to experience and habit and to detect those changes. And I wonder how many people who have experienced retirement or who otherwise leave familiar routines are having similar kinds of experiences with these decades-long habits.
So oh boy, I don't know if I should tell you this. I'll tell you this. You probably won't believe me, but I'm telling you the truth. I don't worry. I don't think I've ever worried.
Uh-huh.
Stress, stressful things happen, but I've not really worried in my life because maybe I was raised, or maybe I was just an ornery kid who thought, is there something I can do about it? If there is, then I got to do it. And if there's nothing I can do about it, well, there's this old Mad magazine, Alfred E. Newman. What? Me worry? What is worrying going to accomplish? It's going to make you miserable.
Mm-hmm. Mm-hmm.
I don't have time. I am stressed. What can I do? If there's nothing I can do, okay.
That's marvelous. You are I'm reaching here that there was a comment by Dante about it's in the chat that I'll read. So I've heard from a few different PCPs that if you are used to only getting 3 to 6 hours of sleep a night, that your body gets used to that and being able to function throughout the day. Is that accurate?
Your body does get used to it. Do you function throughout the day? Not well. Not well. You can assume you are because you're getting through the day and you're getting things done. But there's a cumulative effect to that. It takes a toll on your body. It does take a toll on your mind. And eventually you're going to make mistakes. You're absolutely right. My husband was in the military. He was used to not sleeping when he was out on maneuvers. But here's the amazing thing about the military, for example, they can sleep standing up.
Mm-hmm.
Dan, you probably could too, you and your group. You learn to catch sleep whenever you can. Now, that's a survival technique. So you can sleep for minutes standing up, but that's not good sleep.
No, and
No.
I can't.
Yeah.
But it's not sleep. It is a cognitively detached state.
Yes.
Where you're not fully awake, but it is not nearly the restorative sleep that will experience the REM cycles and everything else that are the cycles of true sleep.
Exactly right. So sleeping 3 to 6 hours. Although, let me just say this too. There are people, we say 8 hours of sleep. There are people who do function on 6 hours of sleep. There are people who need 10 hours of sleep. But if it's a low amount, not likely that you're doing well.
Mm-hmm.
Yes.
I just in a kind of a PSA, I want to commend the good folks who staff the sleep disorder clinics, the primary care physician who referred me to one years ago. And I did a sleep study and I was having 23 events an hour, apneic events. And in the ensuing 8 years of using CPAP devices, that number is 0.5. And I wonder how many people, and I talk to a lot of people about whether they have actually had that assessment done. And for the vast number of people in my age cohort, not many.
Right.
And I'm thinking that this is a largely undetected, unresolved, and and missing diagnosis, which is underlying a significant portion of health effects. It has been absolutely revolutionary personally. And
Yeah.
I didn't think I had a problem. My wife thought I had a problem. So, and I think sleep is vastly underrated in terms of its contributions to health.
Absolutely. And I wouldn't want people to think I'm not suggesting you go to your PCP. Absolutely. That could be the very first step, should be the very first step.
Mhm.
Let's make sure there's no physical cause to this. But the statistics that we talked about and the statistics that I got from the PCPs is there's no medical reason for this. People are looking for the med so that they can get the sleep.
Mhm.
And it's a reminder of how little control you have, which is going to make sleep even more difficult.
Mhm.
Yeah.
Thank you. Other comments? Anybody want to stick their hand up or just unmute? And we're just a little right at the 1 hour mark. But Carol, thank you so much for a contribution not only to our knowledge but to our experience as well.
My pleasure. You can tell your
Thank
boss
you.
that you have to take the rest of the day off.
And we'll write you a note.
Thank
Yes.
you.
I'll write you a note. Yes.
Very
Thanks
helpful,
so very
Carol.
much.
Thank you.
Carol,
Thanks
thank
for
you so
sharing.
much.
My pleasure as always.
Yeah, I mean, it's not.
Melissa, we had a little bit of some last minute change up here. Would you like me to handle the closing piece of this? Or do you
That
want
would
to do
be,
that, or-
that would be, let me have Paul do that part, just because
Oh,
it's about
good.
the evaluation. And yeah, we'll have Paul go through that part if he's around, hopefully. Maybe not. All right, Dan, take it away. I'll put it in the chat.
Okay, thanks very much. So we do very much appreciate everybody's attendance here. We are happy to be partnered with these good folks from Growth Partners, and your feedback is important. So if you will take a moment and instead of paying any attention to me, you can grab that survey link or at least click it so that you can complete it after the meeting. And please do provide us with some feedback. It's very, very helpful and will be deeply appreciated. Our next meeting is August 15th. That is closer than we think. That is about a little more than it's about 9 weeks away. And we will have more information forthcoming on that shortly. Also, please do feel free, if you are not already, to become part of our community practice. We are working hard internally with Growth Partners, with our planning team, to improve communications. And Melissa, did you get that request to stick that in the chat? And that would be helpful to some folks, but do feel free to
Yes,
join
the
us.
evaluation
And,
link is in there.
do take a moment to check out the resources at nhtoc.org. I think I've already covered the evaluation poll. I believe
Yep.
that I'm at the end of my script and I can stop talking. And Melissa, cue me up if I need to talk about anything else.
Sure, no, just let everybody know that this is recorded, so we'll have it up on our website, newhampshiretac.org, usually within the week, so they can review it if they need to again.
Okay. Thanks all. That will be up. I've actually made some commitments to folks who've told me that they have some sleep disorder problems, and we'll be sharing that. And Carol,
Great.
thank you so much. We wish everybody a great day. Have a safe, happy, and wonderful summer.
Thank you, Carol. Thank you, Dan.
Thank you.
Have a great day.